Another interesting feature on the MonCvONE-CR is the capability to do eye tracking. We have a high resolution near infrared camera, and we have software analyzing this image in real time. And we use what's called the Hirschberg technique, or at least we call it. Actually, this technique relies on the measurement of the position of the corneal reflex relative to the pupil. This gives you an indication of the orientation of gaze with some accuracy. It's not as good as getting the eye fundus image in real time, but it gives you, if you have with some experience, an accuracy of about 3 to 5 degrees, depending on some factors. But also, it does allow to evaluate quite reliably the stability of fixation. So we can record eye movement during all exams, during perimetry, static or manual, during dark adaptation, during other tests. On our equipment, we have also multifocal ERG. So you can record eye movement, you can record pupil diameter, you can do the recording of the video at the same time, analyze fixation. And this is a typical report we have at the end of a visual field exam, where we show the horizontal and vertical deviation. We show the pupil size, average value, and fluctuations. We show the rate of blink, and we show what's called usually the BCA, the bivariate contour ellipse area, which is a very difficult word to say, meaning that what's the surface area of where the patient will spend 63% of the time of the exam. And it's given in square degrees. So this is an example of a normal subject. So we can, during the exam, get both the eye movement recording and the video recording. And you can include those in the report at the end of the exam. This is showing a clinical example of patients with hemianopsia. And you see you have a shift of fixation, which is well documented by the recording of the eye movement, as well as from the video. If we have some experience, you can see it from the video. And you see the fluctuation of fixation here, and the BCA is 24 degrees, meaning the patient is making quite a number of movements during the exam. Another example, this is a patient with nystagmus. I hope the video will start here. Yes, we go. So, and show this patient during the exam. So it gives you some good indication about the reliability of the exam. In addition to this, you can plot the eye movement recording, as you can see here on the left, versus time, and see the horizontal and vertical components of the eye movement. Another exam, which is possible on the MonCvONE-CR, is dark adaptometry. Dark adaptometry is used to study the recovery of light sensitivity after bleaching. And so we can control the amount of bleaching, which is generated by the equipment itself. We can control the luminance and the duration. And then after the bleaching, we can program a sequence of measurements for the recovery of light sensitivity. It could be in one location, like it's done classically. And this is showing a typical record from a normal subject. So you have on horizontally the time, vertically the sensitivity in decibels. So in our equipment, we have the same scale of sensitivity for all exams. 0 dB for us is the 318 candela per square meter. It's our reference. The equipment can be at a higher, can go at a higher level, can go up to 3,000 candela per square meter and go down, but our reference 0 dB is always 318, like on the Goldman. So we can record this type of curve of recovery after bleaching, quantify it as the alpha point. We can quantify also classically what is called the road intercept time. So at some level of sensitivity, we can measure the time it takes to reach that level, and we can measure the maximum sensitivity reached during the recording. If you want, you can also make it with different colors. So this is showing a recording with red color, mainly the response from cones, and other colors like blue, eventually green, using these dichroic filters that you can fit on the MonCvOne. You can also do it in different locations, as it is shown here, where it was tested every 5 degrees along the horizontal meridian. The equipment can do also chromatic pupillometry, sorry. So this is a response to flashes of light. And as you can see, you can play with different colors. You can record for a long time. We played with the response from the photosensitive ganglion cells at some time. It can be an interesting test, for example, for children, because they cannot cooperate so well. So there are a number of applications in addition to the other tests I've presented before. We can do also flash electroretinography using just the classic standard ICEV with only white, or in addition, eventually with blue and red Ganzfeld simulation. We can follow the ICEV protocol and monitor all this with near-infrared recording. This is a typical report with the scotopic response, the oscillatory potentials, photopic response. And to be complete, we can do sensory EOG. Nothing really exciting about this, you will say, but it's part of it. Just to mention it, this is controlled from a standard PC. The PC can be put 2 meters away from the stimulator, so that's a recommendation in this time of virus risk. Put the technician away from the patient, you never know. So that's possible because everything is controlled from a standard PC, and we can use a distance of 2 meters, which is a recommendation. It can be connected to a computer network. It can export data as PDF, DICOM, or Excel format. So the applications, as you can see, are numerous. We have the possibility to do standard automated perimetry, Goldman perimetry, dark adapted static perimetry, dark adapted Goldman perimetry also, which is not so frequent on the existing equipment. Dark adaptometry, FST test, pupillometry, and electrophysiology. Now, I will not speak too much about the competition, but as you know, there are a number of equipment that can do the same, more or less, but they can do most of the time only one thing. Goldman perimetry only does Goldman perimetry. We have some competitors for electrophysiology, but they do essentially electrophysiology. We have people who do dark adaptometry, but they do only dark adaptometry, and so on. And the MonCvONE-CR covers all these applications. And I think it's important because if you do a research study, maybe for one protocol, you will only need, for example, electrophysiology and pupillometry, but if you start another study, it's very likely that you will need some of the other features. So a flexible instrument is quite important. This is just a summary of the different possibility offered by each version, SAP Pro, CR, and CR++. You can take a look at this later on. Just the key points I'd like to mention: it's a compact unit, multifunction. It does replace 3 or 4 specific instruments. It can be used also for standard clinical applications. I mean, after you finish your clinical trial, you may use it for just standard perimetry or standard electrophysiology. It is registered as a medical device. It's manufactured with ISO 13485 quality control. It's registered with C and FDA. FDA right now, we still don't have it for electrophysiology, but we have it for all the other features. It's quite flexible. We can adapt it to your own filters, color filters. We can adapt it to test point locations if you want a different protocol, and most of it, it's affordable.